Before we get started on this next segment, we just need to warn you that there are images of nudity. So if you have little ones, you might want to scoot them over to the next room just for a few minutes. But after 2 kids, Tara Burney decided to get a breast augmentation. But what she thought would make her look good and feel better turned into a living nightmare.
Yeah, Tara's doctor wasn't qualified, and the results have left her scarred for life. Her implants ruptured, silicone seeped through her body, her lymph nodes had to be removed, and after multiple emergency surgeries, she's been left with a flat chest.
And she's not alone. More than 120 victims have been left fighting for compensation after having work done by that doctor. We have Tara, as well as specialist plastic surgeon Dr. Amira Sankey, joining us now with a warning for others. Ladies, thank you so much for joining us.
Thanks, guys.
Thank you.
Tara, this is just awful. You've been physically scarred and emotionally too.
Yeah.
Some of the pictures after your surgery are just so confronting. To have that happen to your body, talk us through it. How does it make you feel?
It's something I wouldn't wish on anybody. It's been a very difficult experience. It's quite different to see your body go through so many changes so quick. It's not something I would recommend for anybody or doing ever again.
Yeah, it's something that a lot of people have done, but yeah, I mean, obviously, you thought you were getting surgery from a qualified professional, which I'd imagine would be the first place you go. How did it come about that he wasn't?
Oh, I didn't learn that until way later. I sort of had an inkling that something wasn't right when I was in his surgery, just due to his manner, his demeanour and the way his professionalism. I sort of had an idea, but at that point I was just too scared. I went through with it. Yeah.
Wow. And when did you first start noticing problems with your implants? What sort of physical reactions were you having to them?
Oh, I would sleep all the time. I would lose a lot of weight, no energy, and I just felt genuinely sick. My body just felt like it was fighting an infection that I just couldn't beat the infection. So I knew something was wrong.
So was that your body rejecting the implants?
It was my body rejecting the implants.
Well, sorry, how did you find this surgeon? I mean, did you go for a search yourself, or was he recommended by someone, or?
Where I live in the Penrith area, he's actually quite well known. He was well known.
Yeah.
He actually had quite a reputable website. He looked quite professional. He moved from an old house to a sort of a shop, so it looked like he was getting more professional. And I hadn't heard of any huge, major complications there, so I just thought it was local area, stay with what I know, and I hadn't heard of anyone having too bad of any
problems with it. Amira, talk to us about how this doctor was able to perform this particular surgery without being qualified.
Well, unfortunately in Australia, there are no ways of regulating or stopping someone from calling themselves a surgeon, and specifically a cosmetic surgeon.
How is that even possible?
Yeah.
I know. It's astonishing that someone can leave medical school and immediately print business cards and set up shop and say that they're a cosmetic surgeon.
So what is the difference then between the two?
So the difference between a specialist plastic surgeon and a cosmetic surgeon is that a specialist plastic surgeon is actually registered with the medical board, specifically in the specialty of plastic surgery, whereas a cosmetic surgeon is not registered as cosmetic surgery according to the medical board. It's a fabricated title. In addition, a plastic surgeon is actually a surgeon. So we have a qualification of the FRACS awarded to us by the College of Surgeons, whereas the cosmetic surgeon doesn't have any Australian Medical Council regulated surgical diploma. And finally, it's about training and experience. So a plastic surgeon has years of training in plastic surgery, at least 8 to 12 years of additional years of training in plastic surgery after we finish medical school. A cosmetic surgeon, as I said, can just leave medical school and set up practice. They're just a general health practitioner.
Why isn't this something that we know? You know, I mean, I'd imagine you wouldn't have gone ahead, Tara, if you knew that beforehand.
Oh, of course, I didn't know. I didn't understand there was a grey area. I didn't understand there was a difference between a cosmetic surgeon and a plastic surgeon, and also finding out he was actually just a registered GP. He didn't actually have any qualifications or training as a surgeon.
Because breast augmentations are quite expensive as well, right? So we're talking $10,000, $15,000.
Oh, that's where he sort of goes for like the
So that's part of the strategy.
yeah, part
like
of the strategy. His
kind of
was a bit cheaper.
discount, right?
Yeah,
Bargain basement
so
boob
that's
job.
where we
How much did you pay for yours?
seven and a half.
$7,000. So around half.
Yeah.
And when you actually went in for the surgery, was it in this shop?
It was, yeah, in the shop on the day. He rode a motorbike in, so his hands probably weren't steady. As we
Oh
all
my
know, riding a
gosh.
motorbike,
Wow.
you're always shaky after you ride a motorbike. So straight after that,
And even still, as you were there and sort of in this shop, about to basically have the scalpel cut through your skin, were you sort of like, I can't back out now?
I
This is
could
it?
not back out. I'd already signed a form, and he'd already said, sign this form. And there was all other complications involved. I could not back out.
Did you feel as though he was kind of helpful in a way in terms of putting you at ease about what was happening? Or, do you know, like, or was it a complete bluff in that sense?
It was a complete bluff.
Yeah.
He was there to make his money. It was a production line. When I was leaving, I was home 20 minutes later. There was another girl going in.
20 minutes
yeah.
later?
Yeah, I was at home 20 minutes later after major chest surgery. Once I was leaving, there was another lady coming in. It was just a production line, one after another.
I mean, how does it generally go? Is it usually a stay in hospital overnight?
Not at all like that. So the whole process is different because a plastic surgeon is not only trained in surgery, but trained in ethics and how to treat a patient properly and safely. She should have had at least one very thorough consultation. Most of us do 2 consultations to talk about the expectations, risks and alternatives to the procedure. The day of surgery should be done in a hospital, in a private licensed hospital facility with an anaesthetist. You shouldn't have felt anything, and there should be aftercare as well, organised by that surgeon.
We were just having a look at the photos, and we've seen, Tara, just how badly your particular surgery was botched. But I mean, it could have been worse. We've heard of cases as well of people having backyard boob jobs and losing their lives.
That's right, that's right. So there's been quite a few scares lately, and I think this is why this is finally coming to the attention of the media and journalists and lawyers, and I thank them because it is a shame that so many women are suffering, and it's unfortunately because of the suffering of these women that we can finally point to the difference between a specialist plastic surgeon and a cosmetic surgeon.
And you wouldn't be the first mum as well who's gone, right, I've had my babies,
No.
I've fed my babies, and I'm just going to get my boobs perked up a bit. And then to have this happen, it's just so heartbreaking. I'm so sorry.
What should people be doing then? I mean, like, is there a certain amount of like a credit check or anything like that for if this is what I want to do, for whatever reason you want to do it, what are the procedures that I should go through before?
Absolutely. So 60% of people who've had cosmetic surgery wouldn't have gone ahead if they knew they weren't seeing a cosmetic surgeon. So how can you check? Firstly, you need to check the qualifications of your plastic surgeon, and they should have 5 letters after their name, FRACS in plastic surgery. That's our diploma. Secondly, they should be a member of ASAPS. So if you go to the asaps.org.au website, you can look up your surgeon's name, and if they have an aesthetic surgery interest, they'll be on our website. And then the general checks are that you should be in a proper private licensed hospital or a good clinic, and finally know about the aftercare and know about and understand the procedure you're having.
Tara, what would you say to other women out there who are perhaps thinking about undergoing this kind of surgery? What advice would you like to give them?
Be very careful. Be very careful. Do some really important research. Go with somebody who's very preferable, and I hope that the laws are a bit changed so nobody gets tricked by the cosmetic surgeon or the plastic surgeon, like the difference there.
Almost needs a tick of approval, doesn't it?
Yeah.
You know, a surgery tick of approval.
How are you though? Are you okay?
Yeah, I'm doing all right. Another surgery to rebuild in 2 weeks. Just silicone is floating around. Whitewash.
Well, thank you so much for taking the time to
thank
share
you.
your story. It's
Thank
really
you,
important
guys.
advice.
Thank you very much
Thank
for
you.
having us.
Yeah, for
thank you
anyone
for getting it
considering
out
it.
there and advocating to make a change and make it better. Just everyone has daughters, nieces. Thank you.
Our pleasure.
Thank you.
Well, stay with us. Studio 10 will be back right after this.
Face it.